Hi, welcome to Travel Tales with Judith. I'm Judith, and I share stories and experiences from a lifetime of traveling. This is episode 16, and it's called Dentistry in Chiapas, Mexico. And I'm again going to be reading from my book on this one because there's a lot of experiences and things in there that are kind of interesting or fun or humorous, or maybe a little bit more on the serious side as well. As a matter of fact, a few people have asked me about my book, and it's called Somewhere for My Soul to Go, A Place, a Cause, a Legacy. And it is now out of print. I wrote it in 2012, I think, and it's out of print. But when I get low on copies and I want to keep giving them to people who are interested, I go to Amazon and I can pick up a copy there. So if you're interested, you can see, what you think. Okay, so this is another one, a medical one, well, rather a dental one. And this happened in, I think it was December of 2011. So I'm just going to read the story from the book. As I sit in the dentist chair in San Cristobal, Dr. Bendanya puts his hand on my shoulder and in the most sympathetic voice reassures me with, "Oh, senora, please don't concern yourself. The best thing about teeth is that whatever the problem, it can be resolved, and we will take care of you." About a month earlier, I had a new crown. I had seen my own dentist 5 times for adjustments afterward, but I still couldn't chew on it without pain, and I knew it was still high. I departed for Chiapas still unable to chew on the left side, and my jaw was aching. And as the days evaporated before the group I was to lead arrived, the tooth felt like it moved if I bit on it. I decided to call a dentist whom I had met before and who came highly recommended. The chain of events may sound straightforward, but let me add that I am a worrier. I obsess, especially at 3 in the morning when I can't go back to sleep as I go over my options and then go over them again and again. Do I tough it out and wait 2 weeks until I return to the States? Do I lead a group when all I can think about is the discomfort in my jaw? Do I take the chance of my jaw swelling up and my needing an emergency root canal and antibiotics in the middle of the itinerary? And soon my stomach is aching and my lower lip is already anticipating the cold sore that will erupt within days from the anxiety. After several increasingly stressful nights, I had resolved to be proactive and call the dentist before the group arrived. In Mexico, dentists will actually answer their own phones. In less than an hour, I was in the chair, and Dr. Bendanya percussed several teeth, and the only one that responded was the newly crowned culprit. "Senora, I am not 100% sure, but I think you may need a root canal," he said. Relief coursed through my veins as he added, "And my brother is an endodontist in San Cristobal. Much better than I could have hoped for. When you're kind of in a more out-of-the-way place, even though San Cristobal is a big city, sometimes it feels a little strange and risky to have medical or dental treatment, but I felt like this was the best option." Okay, back to the book. Within 2 days, I had an appointment, and the second Dr. Bendanya, as handsome and reassuring as his brother, completed the endodontic treatment in one 2.5-hour session. The tooth still needed some time to calm down from the vigorous canal roto-rooting, but the ache in the jaw diminished quickly. Later, back in the States, an endodontist proclaimed the root canal perfect. I know that you're wondering about the cost. In the States, a root canal on a lower molar can run $1,400. This was in 2011. And that doesn't that doesn't include the restoration required afterward. Luckily, my crown emerged intact from the treatment, with the exception of the access hole, and Dr. Bendania placed a filling there. The total was $222. Now I understand the rising popularity of leaving the United States to have heart surgery in India or dentistry in Mexico. Surprisingly, my insurance honored that bill. Of course, 80% of $222 was a lot less than their usual payout for that procedure. They must have been delighted.